I have just had a chat with a brand new grandma about her brand new grandbaby, and her daughter is a first time mum, and she had questions about how chiropractic might be able to help at least figure out what's going on with her little one, who is not feeding one way but only turning their head to the side one way. And this is something we see quite a lot in chiropractic care. We address this by checking the baby's movement of the neck and the movement of the spine and making sure that it is moving as optimal as we can. Now, in this particular case, the baby was a forceps delivery, which is not a particularly nice way to come into the world, but new mums and new grandmas need to know that when we check a bub's spine, it is super gentle. We don't x-ray babies, we don't x-ray children. If there's a need to take an x-ray of a child, then that is generally something that's more of a medical concern. But what we do is we check for the proper functioning of the spine, the proper movement of the spine, and in that way we can allow the baby to express its newborn potential and develop its nervous system properly from as early on in life as possible. So if you have any questions about how we go about checking up babies and children, all you need to do is ask, shoot us a message or give us a call or ask on your next visit. I'm more than happy to explain. Very basically though, the amount of pressure we use to check the baby's spine movement is about the same amount of pressure as you can comfortably put on your own closed eyelid. Now, that's not a lot of pressure, but it is enough to be able to check and correct the movement of a baby's spine the vast majority of the time. Sometimes there's a little bit more involved, but that is very rare. Any questions or queries, just give us a shout. We look forward to seeing you again soon.